Hi, welcome to today's Talk of the Town. I'm Sandy Benson. Renee Bannon, representing Encompass Health Rehabilitation Hospital, speaks about their inpatient rehabilitation for their patients. Renee, welcome to the show.
Thank you for having me.
So talk a little bit about what's the difference in your facility that other rehab facilities in the area may or may not do.
Absolutely. So we're a 38-bed hospital that provides rehabilitation, inpatient rehabilitation. We're located in Okatee in Seagrass Station on Highway 170.
Okay.
We offer a higher level of care as we're licensed as a hospital. And what that means, for example, is our physicians that are on site daily are required to round on our patients at a minimum of 3 times a week.
Oh, okay.
We provide rehabilitation nursing, round-the-clock nursing care with RN coverage. We have a dietitian, respiratory therapist, and case managers that will coordinate your discharge plan.
And what types of conditions does the hospital treat?
Absolutely. So we treat a broad range of conditions. Some of the common conditions that we treat are stroke, hip fracture, amputations,
okay,
joint replacements, brain injuries, whether traumatic or non-traumatic, spinal cord injuries, and something as simple as even pain management.
And how long is it typically a patient staying in the hospital?
Right, so our average length of stay is typically 10 to 14 days.
Okay.
Our goal is to help patients really regain their independence in order to get back home sooner.
And so with that extra, I would say, amount of care or health facilitation, you're able to get them mobile quicker.
Exactly,
Okay.
exactly.
And so how does a patient get admitted? Is it from a regular hospital stay and then over to your hospital? Is that
Exactly,
correct?
that's one
Okay.
of the ways. Our admissions process is very simple. If you find yourself or one of your loved ones in one of the local hospitals, it's very important that you tell your doctor, tell your nurse, tell your discharge planner that you want to go to Encompass Health Rehabilitation Hospital, and our admissions team will take care of the rest.
Right.
It's very important to speak up because it's patient's choice to go where you feel that your rehabilitation needs will best be met.
Right, and I know a lot of times they will automatically kind of submit your paperwork throughout,
Yes.
the numbers of locations, and it's a matter of who can accept you at the time, right?
That's
so
right. It can be.
That's and maybe it's not some place that's going to work specifically on a certain situation.
Exactly.
So what happens when the patient's ready to go home? How's the discharge of that patient look like? And then is there care that follows that in some situations?
Yes, absolutely. So we have a team of case managers that actually begin planning the patient's discharge on the first day of arrival. They make sure that the patient's needs are met with scheduling their follow-up appointments with their doctors, coordinating their home care if that's necessary, and by making sure that they have the right equipment at home if needed.
Okay. All right. And then, so what does inpatient therapy look like? Do you help set that up?
Yes, absolutely. So we offer an interdisciplinary approach.
What does that mean?
So what that means is we have a team, so our physicians, like I talked about,
Right.
It's a prescribed rehabilitation program.
Okay.
We have rehabilitation nursing, and we have an outstanding team of therapists that provide all 3 therapy disciplines, whether that's physical, occupational, and speech. We offer all 3 if
right.
needed.
Okay.
And again, our goal is to help patients get back to the community doing the things that they love,
Right.
whether that's playing golf, playing tennis,
Sure.
walking their dog, or just playing with their grandchildren. Our goals are what your goals are, and we want to help you accomplish that.
Very nice. And so, again, it's located in Sawgrass, is that
Seagrass
correct? Seagrass
Station.
Station, and that's off of 170.
Yes, right off the back gate of Sun City, actually.
And if people have questions, maybe if they have a loved one in the hospital, they're not sure exactly what your facility is able to will you advise them into what direction they can go?
Yes. So I have liaisons, so
okay.
representatives in the hospitals that are more than happy to meet with you or your loved one.
Okay.
We welcome phone calls and we welcome tours. If you would like to have a family member stop by and tour our hospital, we'd be more than happy to accommodate that.
Thank you so much.
Yeah,
Appreciate you
thank you
coming
so much
over
for
today.
having me.
Yes, absolutely. And we'll be right back with Talk of the Town.